Well, hundreds of thousands of people within the U.S. will contract pneumonia this year, leading to further health issues or even a stay in the hospital. But today we have Dr. Amar Hussain, an assistant professor of family medicine at LSU Health Shreveport, to help us understand what we can do to prevent such a disease. Doc, it's good to have you here.
Thank you for having me.
Yes, let's talk a little bit about pneumonia. Right now, the mayor of Shreveport is in the hospital with pneumonia, so this is something that can affect anyone. Talk about the most common causes of pneumonia.
Right, definitely. So first, we wish the mayor a speedy and full recovery from his bout of pneumonia. But as you can see, I'll take the mayor as an example. In general, any age can get pneumonia, right? Mm-hmm. So it doesn't matter if you're a child, a healthy adult, or more of a geriatric age patient. Some patients are more predisposed to having pneumonia than others, right? Mm-hmm. So kids under 5 years old can get pneumonia easier. People above 65 can get pneumonia. People with different comorbidities can get pneumonia faster or more susceptible to getting pneumonia. Like, for example, if you have comorbidities like heart disease or COPD, asthma, all these different aspects can increase your risk of getting pneumonia. If you're immunocompromised, like say have HIV or are on chemotherapy for any kind of like cancer, that increases your risk of getting pneumonia. There are a lot of different things that you can do for pneumonia, right? And one of the most important things, and I'm going to say this in the beginning and I'm going to say this at the end, is get your vaccines. It is so important to get your vaccines, get your pneumococcal vaccine, get your flu vaccine, get your COVID vaccine if that's something that's needed, because you can get pneumonia after getting the flu, you can get pneumonia after getting COVID. And it's so important, to prevent the pneumonias that are going to debilitate you the most, right? So you have walking pneumonia, you have community-acquired pneumonia, and community-acquired pneumonia is probably more rampant. And look, if we catch it early and we treat it earlier, you're going to take oral antibiotics depending on what kind of pneumonia it is, and for a short duration, and you might have symptoms of like tiredness and fatigue for maybe 1 or 2 weeks afterwards, but you're going to be back to 100%. Right? But if you delay it and if you just think that it's nothing, then things can be more severe. You can have more of a severe pneumonia, and you can possibly need IV antibiotics. You might need to go to the ICU. Things can get bad really fast, right? Especially those people that have comorbidities like I talked about, COPD, asthma. The things that you can do to decrease pneumonia are decrease or stop smoking. And that includes tobacco as well as vaping, because that decreases the immunity that the lungs have, right?
It really affects the lungs. That's where pneumonia hits you, right?
Definitely. Decrease that. Make sure you're exercising, building up your immune system. You're eating right. You're staying away from people that may be sick. You wear masks. You do hand cleaning. Hand washing. That's really important. But get your vaccines. That's so super important. Some things that you might look for when you're considering, do I have pneumonia or not? If you have shortness of breath, if you have, when you're walking, you get tired really fast, and that's out of the ordinary. You have a cough that's not going away, that's producing phlegm, sputum. You have fevers and chills and high fevers, right? And Tylenol is not really helping. And in the older people, you might have more subtle things like they're just feeling tired and they're not thinking right. Those are important things to see your primary care provider, your provider in general, be that in urgent care or, come see me. I'm at, Ochsner, LSU, Spring Lake. You can come, we'll take care of you. We need to take care of you because it's so important to get the things in the beginning rather than in the middle or the end.
All right. Thank you, doctor. Appreciate it. Great tips.